All right, so welcome everybody, and this is an update we are going to be giving on the Change Healthcare situation and the state's response to it. And before though we get into that, we did obviously have a horrible accident this morning in Baltimore, and lives were lost. So I just wanted to give a quick moment of silence for the people who were lost and the adverse effect of the accident this morning in Baltimore. Thank you, everybody, for being here. And the first thing, for those of you who don't know, I'm Gene Ransom. I'm the CEO of MedChi, and we also have MedChi's General Counsel, Ashton DeLong, and MedChi's Chief of Staff, Catherine Johannes, in here. And if anybody has any questions or follow-up, feel free to reach out to any of the three of us from this. And the first thing I really wanted to do before I turn it over to the Insurance Administration is thank Commissioner Birrane, who is the Insurance Commissioner, and Secretary Laura Herrera-Scott of the Health Department. When the Change Healthcare breach occurred, I guess a couple of weeks ago now, immediately the state began responding and helping and trying to answer questions. One of the frustrating things is that when a private entity does something, or there's a problem or an issue with a private entity, government obviously has a role, but they don't always have a role with regards to everything. So what was terrific about the response of both secretaries was the fact that they tried to figure out how they could use their authority, their responsibility to help solve the problem right away. And I will say that I talked to both of them multiple times, and they've really tried to get information out and do things. Obviously, the Change Healthcare situation has created lots of confusion in the healthcare space. Everything from the fact that Change is the processor for approximately a third of healthcare practitioners in the Maryland region for payments. Change is actually the owner of the bundled payment program that we use for our major value-based care program, EQIP. Change is owned by United Health Group, which is one of the major payers in the United States. So there's all these complexities around this that obviously make this a very difficult and complex situation. So today what we wanted to do was start by turning it over to Commissioner Birrane to kind of give an overview. And maybe if you want, you can introduce some of your staff on the call as well, but give an overview of what you've done to date and where we are. And then we're going to try to answer questions to the best of our ability, unless there's anything else you'd like to add. But I'm going to go ahead and turn it over to you to go ahead and let us know everything that you've tried to do and what you've done, both in your role as the Maryland Insurance Commissioner and then also in your role with some of the other organizations you're involved in nationally. And thank you for being here today.
Well, you're very welcome, Gene, and thank you for organizing this and for the leadership that you and your team have shown in sort of making sure that the information is moving. So let me just start by introducing the members of my team who have been working on this matter since we first got wind of it several weeks ago. So I'm going to start, I'm just going to go where people are on my screen. So let me start with Joy Hatchett, who is the Associate Commissioner for Consumer Education and Advocacy. Among other things, Joy's team manages our newly rolled out health coverage assistance team, where consumers can come to learn information when they have coverage disputes, even with respect to products that we don't regulate. Then I'll go to David Cooney. David is the Associate Commissioner for Life and Health. His team is the team that processes all of the consumer complaints and provider complaints that we receive with respect to the activities of insurance companies, including the failure to pay claims and to pay claims timely. Our appeals and grievance unit sits under David's leadership. And then Mary Quay is the Associate Commissioner for Market Regulation and Producer Licensing. Her team is the team that looks at the market conduct. So when we see more than individual complaints, and we really need to assess what a carrier is doing, that is when Mary's team gets involved. So keep that in the back of your head as we move forward, both with respect to this matter and other matters, that this is the dream team and this is how they break up. So if you need assistance, those are the places to go. Craig I, who is our Director of Communications, is also always available to direct questions in the right way. If you're not sure where to go, you can go to Craig. So with those introductions, let me just take a moment to talk a little bit about where we've been and where we are and where we're going. So, and to do that, I just want to step back for just a minute and provide a little bit of context. So First, as most of you know, the MIA regulates insurance companies with respect to insurance policies that are issued in the state to individuals or to groups. So with respect to the Change Healthcare breach and health system disruptions, the MIA, from a statutory enforcement perspective, is focused on the activities of those insurance companies as commercial payers. We don't have jurisdiction over Medicare, the federal health plan, the state plan, most county and municipal plans, self-funded plans, MCOs, or Medicaid. About 17% of people in Maryland are covered by the health insurance plans that we do regulate. So I just want to level set that. And when we are discussing claim payment disruption issues today, we really are focused on the plans that we regulate where we can intervene. That is health insurance provided under a policy of insurance by a commercial insurer. Now, that doesn't mean that we're not going to take your questions, and it doesn't mean we're not going to try to help you get to the right place to get those questions answered, even if we're not the regulator. Second, we have been meeting with MDH, as Jean mentioned, and with the National Association of Insurance Commissioners, where all the insurance commissioners get together to both receive and provide information in as close to real time as possible. We're supporting MDH in particular and using our social media platforms and website to push out communications. We released a consumer advisory and a provider advisory. They're also on our website with links to information pages and an invitation to contact us here at the MIA if any additional help is needed. Even if we aren't the ones who can help you, we will try to get you to the right place. I will say that to date, we really received at most a handful, really less than a handful of complaints, and most of them were inquiries about the cybersecurity aspect of the breach, which I'll get to in a second. Third, I just want to let you know that we contacted insurers as soon as we were aware of the breadth of this incident. Our inquiries, which are very similar to what other states have done, have really been focused on, did the insurer use change itself? Did the insurer itself use change for any functions related to prior authorization, claim receipt, claim adjudication, or claim payment? We wanted to know what accommodations the carriers were making to receive claims from providers who were using change directly or where change was sort of the underlying connection or software for whatever EDI that the provider was using. Our questions also sought information about claim volume impacts, restoration of volumes, what kind of claims were being impacted the most, and what actions the carrier was taking to assure that if there was a claim spike as systems as restored, they would be able to manage that. I can tell you that fortunately, and I think this is why our complaint volume is pretty low on this commercial insurer side, is that providers interacting with commercial carriers, only one of our commercial carriers was using change for its own internal processing. That was Kaiser, and it was very, very minimal. So all of the other commercial carriers, the Blue Cross entities, United Healthcare itself, as a commercial insurer, they were not using change. They also confirmed that they did not use change for prior authorization, and that they reported to us that they have not experienced a disruption in prior authorization communications for their commercial plans. They reported that they implemented alternative claim transmittal options quickly, and we've been tracking with them information on the restoration of claims volume, which at this point appears to be back to or very close to normal. Now, having said that, we do know, we want to understand your experiences if they have been different. So we want to hear circumstances where your experiences have been different so we can help address them with you. And I also appreciate that change was used by other payers, including MCOs, and that there are providers that may have experienced issues with those payers. And while we can't resolve those questions for you, we can at least help get you to the right place to get answers. And then finally, before I turn it over back to Jean for questions, I want to note that we are at the early stages of addressing the system breach. So our first priority has been to address the disruptions to the healthcare delivery and payment system. But equally important is the question of the extent to which protected data may have been exposed or released. So the MIA is and has been working nationally with the NAIC on addressing those questions, as well as tracking what our insurers know on a local level. So we have assurances to date from our carriers that they have no evidence so far that their systems were breached. What we do not yet know is what information that may have been held by Change may have been accessed. It often takes time to obtain this information, and we're aware that federal law enforcement has been involved from day one. I will also say that we don't regulate Change itself. We regulate insurance companies, some of which may use Change, not so much in Maryland for our regulated entities, but certainly in other states. And so we don't have the same leverage as we do of our licensees to get information from Change. But we, and by we, I mean the national collective of commissioners, are working directly and closely with United and Optum to try to get that information. So with that, Jean, I'm going to turn it back to you, and my team and I are happy to either answer questions or take the questions and try to get answers or direct people to the right source.
Okay, we have a couple questions that people have sent us in ahead of time, but what we'll do is anybody who wants to ask a question, just raise your hand. I will ask one of the email questions to give you guys time to think or formulate, but I really would encourage people to do that. So one of the questions we got was Change is being used by the HSCRC as the bundled payment program for the episode quality improvement value-based care measure. And one of the concerns was because they control because the Change really does do the calculations and knows the information. Was the patient data related to that captured? Do we know whether or not it was captured? If it was, has it been added to the list of items that we're asking about and thinking about when we talk about it? Because I know there's been a lot of focus, the person who's asking the question says there's been a lot of focus on the payment issue, but are we also thinking about that? Because literally there are probably about 3,000 to 4,000 physicians in that, and maybe as many as 1 million Medicare beneficiaries in that program. So that could be a significant amount of consumer patient protected data that would have been captured.
So the answer is yes. So the MIA is not focused on that, but I have connected with both Ben Steffen and John Crom in just sort of looking at the broader issues, obviously both the value-based care calculation piece as well. So I would suggest in that instance to reach out to either John Crom or Deb Rivkin. So Deb Rivkin, many of us have known for years, who used to be with Care First, is now the Director of Government Relations and Policy for HSCRC. So I would suggest that you I know that John and Deb are all over that issue, but for details about how they're addressing it, I would go directly to them.
Okay, I'll let Kathy ask the next one that I know got emailed in that she has, but don't be shy. Please raise your hand and ask the questions. We've got quite a few people, and I'm seeing quite a few bigger practices that I'm aware of on this call. So please don't be shy. But Kathy, why don't you do the other email question we got?
Yeah, given the severity of it, is it likely that patient data and entities' revenue data were both compromised, putting the entities at risk of financial harm? I think you addressed this a little bit, but is there anything more you want to add to that? And what measures should providers and users use to secure potentially compromised data and shield entities from potential financial and reputational harm?
So what I'm going to say is that I don't know what data Change had where and in the pipeline. It is my understanding that when they became aware that the breach occurred, that it's sort of like, it's throwing the tarp on the fire, that they just took their systems down immediately. But I don't know, we do not know whether there have been different reports, whether this was a ransomware attack, whether there was an actual data breach, whether data was actually accessed. I would like to tell you that we have that information, but we don't have it yet. We only have information from the insurance companies that we represent, where they've made reports on their awareness of the change breach, and they do not believe any of their systems have been breached. But as far as the scope of what it is that may have been accessed on the change system, we simply do not know. I can tell you that that is not from lack of asking, but we do not have that information as of yet.
All right. Well, I have another one. If again, if somebody wants to raise their hand, we don't want to monopolize it, but we did ask for questions and got a few at a time. Is there going? This question is essentially from a smaller practice who's switching to a different processor. I'm not going to read all the background, but essentially the question is, if there is any problem with regards to payment processing timeliness as a result of this incident, will there be any forgiveness of the rules around that, either by the carrier or by the MIA?
So I guess what I would say is that let's think about individual cases as they arise. I mean, one of the things that we have reached out to our carriers to talk about and lay out our expectations as a regulator is that they're not holding anybody's feet to the fire. And, you know, whether that has been if there were circumstances related to this incident where prior authorization for some reason couldn't occur, we've asked them to consider that and to make accommodations. So far, they've told us that they don't have any of those situations. We've also been really clear that we expect them to be able to address and adjudicate claims quickly, and that they need to ramp up staff to do that. They need to do that. If you have a problem, come talk to us, because our communication with the carriers has been accommodate. David and Mary are more on the ground than I am in those carrier conversations, if you want to comment on that. But thus far, we found the carriers to be pretty open to that kind of flexibility.
David, did you want to say anything on that? Or Mary?
The responses we have had from the carriers are that they are closely monitoring what's going on and that they expect to be able to handle anything that is coming. They're closely monitoring their claims volume and report that it is currently back to the pre-breach status quo. And that they are awaiting the forensic reports, the forensic investigation and reports to be completed by change, so that they will know about what data they may have that has been compromised. And so I would expect at the same time that's when providers will hear as well.
Ashton, you have a question?
Yeah, I just wanted to ask, since this is a cyber attack and now it's all in the forefront of everybody's mind, I wanted to know whether or not the MIA might have some resources about cyber insurance going on a different sort of route that could aid in educating our providers and those that are purchasing cybersecurity insurance.
The answer is yes. So Craig was particularly involved and Joy's team were involved in an educational webinar that we did maybe a year ago now. There would certainly not be any particular changes in the information, but what that webinar did was it invited federal and state law enforcement to talk about cyber security, cyber events, cyber risk, then talked about what kinds of products are available and how you assess the kind of products that are available. And then the MIA talked about, the kinds of questions you should be asking of agents and sort of what those coverage options are. We also do have materials on our website as well as the NAIC's website about what cyber insurance is. Obviously, that for this incident, sort of the horse is out of the barn, right? But going forward and thinking about the kinds of protection that small practices, really any size practice as a business, ought to have in terms of protection, there are resources that we can offer. I will tell you that the cyber insurance space can be a challenging one because it's evolving. As cyber risk expands, the coverage forms, what coverages are available under what circumstances are also evolving. So, for example, once upon a time, there would often be very broad cyber insurance coverage under, premise liability and property type policies, so that if there was a breach, it was almost a throwaway coverage, even if it had a sublimit. Those days are really gone because of the prevalence of cyber events, which then lead to privacy breaches. So you see many more standalone policies, and many of those policies are not on standardized forms. So you have lots of individualized coverage forms. So this is an area where, the MIA strongly recommends that you work with a knowledgeable insurance producer who has experience in this space, who can understand your sector and understand the needs of your sector and help you right size, those coverages. So that would be our recommendation. Craig has put in the chat both access to the webinar and access to our cybersecurity information page. But I think what you've inspired is that what we probably really should do is update and see if we can't put on a new presentation. And Jean, maybe we can focus this one on health providers particularly.
That'd be great. We
So,
would love to help
yeah.
you promote it. I think that's a great suggestion.
Yeah, let's work together to figure out how to customize something for this industry in particular. Thank you, Ashton. We will make that happen.
And the other thing I wanted to say is we have on the call today Shelley Browse, who is the CEO of Unity Insurance. And Shelley, maybe you can put your contact information in the chat. So if people have questions about cybersecurity, you can help them with it. Any individual questions that they might not feel comfortable asking on a forum like this.
I'd be happy to.
Okay. Okay, so some people are direct messaging me. I get the impression some people don't want folks to know that they're dealing with problems. This is from a large hospital practice. We're hearing the change will get back to normal within this week. Is this realistic? Also, once change gets back to normal, how long will it take the delays to work themselves through the revenue cycle process?
So the information we're getting, and I don't know, Mary, David, or Joy, which of you sat on the last CISO update? The last information I received is consistent. They expect to be more or less back to normal. They have their third-party attestations, I think, are complete at this point. And when they say back to normal and they say things are restored, that does not necessarily mean every single person, right? So there are small subsets. As of a week ago, they were still finding, from what I understand, challenges with Medicaid, pharmacy, fee-for-service providers. So there are these pockets of providers that they're still needing to do a manual process. So when they're talking about their systems, they're talking about sort of the big chunk, but they have 1,200 different sorts of sub-products. So that doesn't mean that every single one of them is going to have the same level of restoration. So that's the first thing to keep in mind. And it's not like we're getting, an update on where every one of those subsystems and every one of those products or sub-products where they are in the restoration process. So I would say that at a high level, things are expected to be pretty much back to normal by next week. That doesn't mean everything is going to be back to normal. With respect to payment, I really can only address our entities that we regulate. What we have been hearing from them is that their claims volume is almost back to normal, and they're processing claims on a more or less normal basis right now. And if they get a surge, they're able to deal with it. And that's true whether it's a hospital or a hospital-based group or any other kind of group. What I can't speak to are sort of other systems, particularly Medicare and Medicaid. So CMS has been much more involved, as has Maryland Medicaid, on how those payment systems are happening. So we can try to connect the dots that we have on what we, and get you to the right place for getting information on the Medicare side, which is CMS. And on the Medicaid side, I think that Secretary Herrera Scott and her team have done a really good job of getting information out there. I hope that gives you some of the information you were looking for.
Okay, Colleen.
Thank you, Jean. I want to go back a little bit. There was just one phrase that kind of stuck out in my mind and would like a little further explanation on what was meant by pre-breach status quo. What did you mean by that?
Pre-breach status quo. I don't remember what I said that in the context of.
I may have said that with
Yeah.
Yes, you did.
claims volume. And basically, carriers track their daily claims volume very closely. They know the date of the breach and when they shut off their contact with change. And they know that they did see a dip in claims volume following that. And they say that they are now back to the level of daily claims volume that they had prior to cutting off their contact with change.
Very good. Thank you. That's a much further explanation, and I appreciate that.
All right, this is from a small office-based practice. Our EHR practice management software refuses to give us our 837 files to be exported out of their system to upload into another clearinghouse. We are manually entering claims. Any support or suggestions on how to mitigate that?
Wow, that's a hard one because we don't regulate the EHRs. We have no authority over them whatsoever. If you send me a note privately, I can always call and ask a question, but that's all I can do is call and ask a question. I can't make them do anything.
So
We can inquire.
And again, this was a message from one of the participants
Yeah.
from the call, but I've heard from several small practices where there've been challenges for them to switch to Availity or one of the other processors, and change has made it difficult. So it seems that that's an issue. And I guess maybe as a follow-up to that, does there need to be additional statutes or regulations regulating EHRs and these practice management softwares and these processors? Because it seems like the answer we're getting from everybody is it's the Wild West and no one regulates them. And that seems to be a problem given what we've seen here.
Yeah, I mean, I think that there are a number of policy discussions that have to take place after this. And that's going to be at both a federal level and a state level, right? Because you also don't have one uniform regulator, and I'm just talking at that point about state versus federal and what part of the federal government, because you have different payors, right? And you have a bunch of different federal statutes. So, just in our efforts, for example, to regulate PBMs or PSAOs, it depends sometimes on who the payer is, what you can and cannot do, even as a state legislature and policymaker. So what I would say is that those policy discussions do have to address, who can be an EHR, who can be an EDI, what are their qualifications, who oversees them. And then there's a whole separate question about combinations, right? There's a whole separate question about sort of some of the antitrust concerns that came up over this acquisition to begin with. But the acquisition went forward anyway. So I think, Jean, that you're correct, that there really are a lot of policy decisions that are going to have to get made. A lot of that isn't within the insurance regulatory space. These are adjacent spaces that insurance commissioners don't typically regulate, but there are discussions that have to be had. But with regard to this particular question, as I said, that we don't have any authority. We are asking a lot of questions. These are the kinds of questions that are being asked at a national level, in how Change is operating, how United and Optum are operating, although we don't regulate every United and every Optum entity either. But, you know, again, I would say, Jean, if you want to facilitate, or if this person wants to reach out to me by email, I can at least pick up the phone. That doesn't mean that may not mean anything, but I can at least pick up the phone and call the entity and ask them what's going on and why.
All right, I'll connect you with a practice offline or with someone from your team. Lisa, go ahead, Lisa.
You're on mute.
Lisa.
She may have trouble getting off of mute. Lisa's on mute.
Yeah, Lisa. Well, all right. While we're waiting for Lisa to get off, whenever you get off mute, just yell out and we'll figure it out. So I have another person who's asked, Care First is using Change and Prometheus for their value pace bundler. Has there been communication with Care First about the effect of that? Will that delay payments under their value-based care program?
I don't know whether it will delay payments. There are two that they process that through because that's where the Medicaid value-based care, Care First has aligned their commercial value-based care with the Medicaid commercial-based care. I don't have any reason to believe that there will be any payment problems. We've asked Care First that. Mary, David, step in if I'm saying anything wrong. They've assured us not. However, I do know that the person you want to ask specifically about Prometheus, which they will be in the process of, or they're already in the process of moving away from that, is John Crom and Deb Rivkin.
Right.
Who are
So I chair the equip committee for the HSCRC. So we're going to move to PACES. I know that on the Medicare side, it's Medicare, but for Care First, they use it in their commercial plans and their ERISA-based plans for their value-based care, and they use the Prometheus bundles. So that was the question they were asking, since that is something you guys regulate at least 17% of. So
well, let's go. We will go a step deeper with them in our questions, but what they've told us so far is no. It's not going to have an impact. But I can, and that's why I'm asking Mary and David if they've dug down into that next layer. But we talked to Care First on this a lot, and what they've told us so far is no. But I can tell you that the last time I spoke to Todd, that I specifically asked him that question. I have talked to him about the fact that they use that system in that way. And I've talked to him about the fact that there's not going to be payment disruption. But I have to say I didn't connect those two things in a specific question. Mary, do you have more information?
I don't think so. I will follow up on that. And I will double check if there is anything in my records. I don't recall that specifically coming up. And they have, as you said, told us there are no specific problems.
all right, I was going to see if Lisa wanted to try again, and I know Kathy just messaged me. She's got another direct message question. Kathy, do you want to go ahead and go?
Yeah, sure. I got another one that was direct message, which I appreciate because we understand the sensitivity of these issues. So it's quite fine to just send me or Jean or Ashton the questions directly. So this one mentions that in Virginia, in the Senate, there has been a Healthcare Cybersecurity Improvements Act introduced, allowing for expedited payments to healthcare providers in the event of a cyber attack. Can you comment on whether Maryland has any similar legislation in the works? Anything you're aware of?
So the Virginia legislation is focused on cybersecurity where?
Healthcare Cybersecurity Improvements Act. So it would allow for expedited payments to healthcare providers in the event of a cyber attack.
I am not aware of any such legislation that has been introduced in Maryland, or any discussions about the introduction of that in Maryland. And I don't know, I would have to look at the bill to see what the scope of it is. but I haven't heard that conversation in Maryland. Jean, I don't know if you know otherwise.
I'm not aware of anything going in either. I would suggest, and if you're comfortable with this, maybe we should have a discussion with the health department, your agency, MedChi, and maybe MHA as well about what policy levers should be considered, because it does seem that something like that makes sense, and we should really have a discussion. While maybe we can't regulate the PBMs and the plans because of the nature of the split jurisdiction, I think we certainly could regulate the EHRs and the processors, right? That's something that we would think we would have the ability to do. So anyway, I just think we should have a higher level discussion once you have more data and we know exactly what the harms that were done were.
Yeah, I mean, I agree. And I think the other conversation probably around this is what kind of emergency powers exist and when do they kick in, right? So when this incident occurred, one of the first things that our team talked about is there going to be any sort of basis for the governor or the federal government to declare some form of emergency? Because when there are emergencies that are declared, the MIA has some powers that kick in with regard to health insurance. I'm not sure that those powers necessarily align here with the needs of the providers, but it's always good to step back, when an incident occurs and say, what do we wish we could have done? What power do we wish we had had? Under what triggers? And then have that discussion as well.
One of the other things is during the COVID crisis, the CARES Act was very helpful, where there were prepayments that went to physicians. Maryland did try to do some of that, which there were management problems with, and I think the the Medicaid department is still tracking down money. So it might make sense to talk about the authority for, and how would you do it, to do prepayments as well. All right. Are there any other questions from anybody? Anybody else want to ask anything?
Hi, this is Lisa Dudley. I think I've come off mute. Is that correct?
You are. Great. Thanks for getting on. Go ahead, Lisa.
Awesome. So I'm not sure if this is the correct forum based on the questions that I'm hearing, but I did hear Kathleen Birrane say that claims are back to pre-cyber attack levels, but we are still not connected to Change, and the only way to contact them is via email. The last we heard from them was last Tuesday, and they said they'd follow back up on Friday, and we've emailed several times but not heard anything from them.
Let me just track your question. Who's the they in that sentence? When you say they, who do you mean?
Change Healthcare.
Okay. Yeah, so when I talk, no, go ahead. I'm sorry, you go ahead.
No, you go ahead. I apologize.
No, not at all. The only reason I interrupted because I wanted to make sure who you were talking about, who you only could email. Was that a carrier or was that Change? And it sounds as though
that's actual Change.
Yeah. So we're looking at it from the insurance company's perspective. So the insurance companies are telling us that their claim volume, the amount of claims that they would expect to receive, is pretty much back up to normal. And that doesn't mean every single type of claim for every single company is exactly what it was before. And obviously claim volume always fluctuates, a bit. So that doesn't mean that individual providers, which is why it's important for us to hear from you guys, because that doesn't mean that individual providers aren't having challenges. But our insurance companies do not use Change. Our insurance companies are receiving information from Change. So the provider is using Change to submit their claims. And we know that you're having challenges still with respect to Change. Change is telling us that most of their systems are either back up or are going to be back up. But I know for a fact that there are some providers where some of their services are not going to be 100% restored. What I don't know is which of those there are. what I can say to you is that if you are trying to submit a claim to a commercial insurance company, the insurance companies have told us that they will accept claims by fax, they will accept claims by email, that they will accept claims. I mean, this is silly, but maybe not, literally walking them in the door. They are paying claims through a variety of means. I had one carrier tell me that they actually ran out of paper checks because it's been so long since they've used them, and they had to, print a bunch of paper checks to get stuff out. So if you are having trouble connecting to the insurance company to get your claims to that insurance company, please reach out to us and we will help you make that connection. I can't fix change. I can't tell change what to do, but I can help you get to the insurance company so that it gets your claim.
So let me suggest this,
Okay.
because could someone put the place to contact the MIA in the chat maybe, and maybe you can send somebody and we can send it out and connect you with these various practices that have reached out. It seems to me, just to the problems that we're hearing, what we're hearing typically is that practices have switched to another processor and the processor is working for new claims, but they have a bunch of claims that never made it. And it's been very difficult to get those uploaded, and they're doing them manually. And they're really afraid they're going to lose a lot of money, or lose some of those claims, or they're not going to be timely. And then the second issue is other practices have decided to stay with change and it continues not to work. So that's really the big issue we're having. And I guess the other issue is if anybody can help with regards to how to file claims against change. I'm assuming there'll be a class action suit or something, but if there's an insurance avenue for these practices who've used claim to make claims under their thing, or maybe they need to do it under their contract, I don't know, that would be helpful as well. Maybe that's outside your scope, but that's where I think we're hearing the bulk of the concerns.
Yeah. The change part is outside of our scope.
Mhm.
Craig just put his contact information. What I would suggest you do is email him, and then he will distribute it to the group. We'll figure out who's the right person, whether, it's our Life and Health Complaints Department, which is Terry Smith with David Cooney, whether there are certain broader market practices or the cyber piece that Mary's team will look at, whether there's messaging and education that needs to occur, which is what Joy and Craig work on. Or whether it's, whether I feel like it's something where I could be a value add if I get involved personally and put a little pressure on something. But for current purposes, what I would say is what you're describing, which is those providers that have found a methodology to get claims submitted are still experiencing sort of this crunch with stuff that may have been in the processing system when change went down. And that's the bucket of claims that may be the most difficult. And what I want to do is talk to the carriers about how do we work together to solve that? Like what's caught sort of in the gears, and how do we make sure that providers are able to get those claims to the carriers in a way that if change ever opens up and those claims ever come out of those gears, there's a mechanism for, making sure that there's no redundancy. So I think that that's a question for us to go back to the carriers and see what they've anticipated there, what they have in mind there, and then get that information and get that back out to Eugene so you can give it to your members.
Okay. I had another practice who just asked me. I had cyber insurance and business interruption insurance. The cyber insurance didn't cover this because it wasn't my breach, it was the other company's. My business interruption insurance didn't cover it because I didn't have any property loss. Is there any way to insure for these types of things appropriately?
Yeah, I mean, business interruption insurance kind of almost by its definition really deals with an event, another peril that then causes your business not to be able to operate. So there are different kinds of business insurance policies that aren't dependent on a a physical event like a fire or something of that nature, they are more expensive. They do exist. So you would have to buy that kind of business interruption. There are other policies that exist with regard to, cyber insurance that would, cyber insurance coverage responds to your losses and your risk as a result of a cyber incident event. There are cyber insurance policies that cover your liability if you are at fault with that event or you have liability, someone sues you for that. And then there are policies that cover you if you are the victim, so to speak. But they only respond to actual loss or costs that you incur in order to, defend yourself if you're the at fault person who's being accused of liability, or if you've had to incur costs in order to remediate or address. So again, those are specific policy forms, and that's where sitting down with someone like Shelley or another trusted advisor to walk through what you're actually buying. Because I empathize with you in cyber insurance in particular. The coverages they're really complex, and a lot of people are like, wow, I have this insurance, but it only covers a piece of potential liability. And so I think that's even more reason to have, a seminar, webinar that's directed much to healthcare providers so that we can help them understand what those different kinds of forms are, so that in the future, you have what you believe you actually need as opposed to what you think you have and don't.
All right, I got another.
Kathleen, may I
go
just
ahead.
make one other comment along the lines there, just an add-on, and makes this whole situation a little unique, is that the loss of income, while it's real and is impacting, the providers personally and professionally, it's considered a temporary loss. It's not a permanent loss of funds, as if your building were to burn down and you weren't able to get the income back. So that puts a little bit of a nuance on the coverage definition as well, which has made this whole thing very challenging.
Yeah, I agree.
I have a question from a behavioral health clinic. Gene, could you ask if there is a direct link to the insurer fax email information to said claims? I am unable to find this information anywhere, and we have a client who has not sent a single claim since 2018.
Wow.
I was able to fax Medicaid and was told the turnaround time is over 30 days. Do you know the turnaround time for faxing, emailing other insurance claims?
So I don't know the answer to either of those questions off the top of my head, and I don't think our team does either. But if you reach out to Craig with that provider information and what insurance company, or maybe it's multiple companies that they're trying to submit claims to, will help you make those connections and get that information to you.
And I'm gonna strongly suggest that Lisa, you, Tracy, and Amy all email Craig. Please make sure you get the info in the chat. I think all three of those, if they can't answer the question, they certainly have the ability to pick the phone up and get an answer for you. So I just think that's the smartest way to go. Last shot. I'm going to ask one more final question. That's for me, unless anybody else has a question they want to ask. All right, the last question I haven't. I've been complaining. Oh wait, Jody, you have a question. Go ahead.
Hi, yeah, so we are like a little bit unique, and I feel like we're kind of getting lost in the shuffle a little bit, but our change actually does our billing for our physician practice. So we don't really have any workarounds. We're just like completely frozen since February 20th. And we're just really starting to worry about timely filing. And so I don't know if you have any suggestions of like what the best way to like reach out individually, because I just worry on a sheer volume standpoint, insurance providers aren't going to be like, oh, well, they haven't submitted their claims, so we're just starting to feel like if there's, do I reach out to provider reps, or like, what's the best way to just kind of proactively feel a little better about that?
So when you're talking about timely filing, you mean that your if you don't file within a certain number of days, you will miss the opportunity to get reimbursed because of your contract terms.
Right.
Yeah. So I think that it is important for us to reach back out to the carriers on that point. We've asked them for accommodations. We have no reason to believe that they're not going to be understanding, but given the amount of time that's gone by, I think it's worthwhile for us to go back out with that specific question again and to get more written guarantees. The other thing is that as you're coming up on dates and deadlines, I'm not deep enough into the weeds of sort of where you were in your process and what you might be able to send out in what way. But what I do want to do is make sure that there is a conversation occurring between your practice and whoever you're contracted with, so that you're able to say, look, this is my situation. Because even if 90% of the time, 90% of providers are able to get done what they need to get done, if 10% can't, then we need to address those problems with that 10%. And that's not going to show up with us tracking claim volume, right? So we need to hear, that's part of the conversation we're having here, is to hear from you what your individual and specific concerns and needs are, so that if it's a broad question, we can go back to the carrier and get information and share that. And if it's a specific problem like the one you're having, but I'm sure you're not alone, but that issue, we can make sure that you have a channel to the right person within your provider, so that you can make arrangements with each of the providers you're contracted with. So Jody, I would again encourage you to reach out to Craig, and let's help get those lines of communication set up for you. We will separately and additionally query the providers about, the carriers about how they are set up to accommodate those specific conversations, and whether they have invited those conversations so people know where to call and how to seek accommodation from a contractual standpoint, that are kind of caught in the gears the way you guys are.
So Jody, let me ask you one quick follow-up question, because if I think I understand what you're saying is you actually have a full RCM contract with Change. They're doing all your billing and processing as well as just the transfer of the data to the carriers, correct?
Correct. Yes.
Yeah. So when you reach out to Craig, also reach out to me as well, because yours is a little different. Yours is really might be a breach of contract situation, and they're not fulfilling their obligations under the agreement. So why don't, and I put my cell in the chat and my email, and anybody can call or email me. I don't, anybody else who has a question or didn't feel comfortable or wants to, but why don't we have a discussion, because we really need to look at what the contractual remedies are in that RCM contract. And actually, this is the first time I've heard from any practice that they have a contract like that would Change. I heard conceptually that they existed, but I didn't really understand how that was working. So that's a really big problem, because essentially that means you've had no money for over a month.
Correct. Yes.
Yeah, that's bad.
Yes.
Yeah. So if you don't, like I said, you can just text me and maybe we can have a conversation later today, and let's see if we can't come up with a game plan, because that's kind of urgent.
Jody, are you getting have you gotten any outreach from Change, or even with respect to their, so-called lending program?
Yeah, so we have, the terms were really bad. Like they weren't, we didn't feel comfortable proceeding, but I will say they did come back Friday and changed some of the terms that we didn't like. So we're reviewing again this week, but as of before Friday, that was a definite no. Now it's a maybe. We just need to see if we, there's still some things about being able to debit from our bank account that we don't like.
So that is an area that on a national level, we've been having a lot of conversations with, and there have been a lot of concerns about the terms, about the payback terms, a lot of questions around the waiver terms. So I may circle back to you at some point if in terms of what you're seeing. and how they are evolving, because they've gotten, not just by insurance commissioners, but they've gotten a lot of pushback on some of the demands that they're making as conditions of those loan agreements. And so I'm reach out through other channels to get a better idea of where they've shifted their posture. But I may come back to you and ask you if we can talk to whether it's you or your counsel about what you're seeing and how they've made changes.
Sure.
Thank you.
Mr. Shaw, go ahead. We got a few minutes left. Go ahead. Charlie. Oh, you're muted.
Yep.
Go ahead.
Sorry about that. Yeah. Hey, first question, is there going to be a follow-up meeting in X number of weeks to address what I think is going to be the fallout, which is once these claims start processing, the payers have no way to determine what a legitimate denial is and what a denial is that was created because of an issue with authorizations, issue with eligibility, issue with a member coming in as out of network, because their systems are just going to say it was a legitimate denial during that period. And I'm just putting money on it that a lot of the providers on this call today are going to start seeing a spike in denials. I think it'd be wise to have a follow-up call and really get a handle on how many people are seeing erroneous denials.
So David, do you want to address the providers? I mean, I know volume is an issue, but if you're getting information through change, you know, carriers have to provide EOBs, so, but to the patient. So David, you want to address that, or what they should do if they see that?
I mean, if they see that and they're concerned it's an inappropriate denial, absolutely they should file a complaint with my team here at the MIA, and there's instructions for how to do that on our website. But one of the commissioner mentioned earlier, one of the things we specifically asked about was that situation if claims are going to be denied in the future because prior authorization wasn't obtained because it wasn't able to be obtained due to the change outage. But across the board, all the commercial carriers explained their prior authorization process and assured us that the prior authorization issue in particular would not be an issue. So if it is, we definitely would like to look into that further. And then like the commissioner mentioned too, when there is a denial, the explanation of benefits has to be provided to provide a specific reason for the denial and everything. So that's required to be provided. If the reason for the denial, seems inappropriate, then absolutely. Well, I mean, frankly, you can always call the insurance company first. They do overturn a lot of these things through internal process. But if you have any issues whatsoever with the insurance company, file a complaint with us and we can look into it.
So, and let me just say, we will have some type of communication follow-up once we have more information, obviously. And if it makes sense to do another one of these calls, we'll do another one of these calls. We'll figure it out, whatever is the right way to communicate it out. And we are constantly sending out information, not only from the AMA and the MIA and the health department, wherever we get it. So we're going to keep doing that, and we'll figure out the next best step. So I don't know if you want to make any closing comments. I'll save my last comment about antitrust and the unhealthy market concentration that one carrier has for another time, Commissioner. But I don't know if you want to make any closing comments about the change situation. I just want to say we really appreciate you and your team being so responsive and trying to help us out. And thank you for your time today. We really appreciate it. And I don't know if you want to say anything else.
Just to say thank you for engaging with us. We're not going to have all the questions off the top, all the answers off the top of our head to all the questions, and we may not ultimately be the organization that has authority, but we are happy to partner with you to try to get information, try to create connections, to try to provide, educational information going forward. Just keep the lines open, and I would just encourage folks, whether they come through Eugene and your organization, or whether they reach out directly, connecting, with Craig, or filing a complaint on our website, just don't hesitate to reach out for help, because we will do our best to help you, even if we don't have the authority. We will do our best to get you to the right place.
Well, thank you so much, and thanks everybody for participating today.